focus on Parkinson's disease in this lecture. Now again, Parkinson's disease is due to decreased dopamine levels. Now these decreased dopamine levels are going to cause very specific clinical manifestations. Now again, I'm trying to prepare you for the Nclex exam, so I'll try to point out the ones that you must know for the Nclex exam. Number 1, tremors. This is typically the first sign of Parkinson's disease. Now this is especially prominent at rest. Typically there will be a hand tremor, something known as pill rolling. Again, this is prominent at rest. Number 2, rigidity or sustained muscle contractions. Now imagine you contracting your muscles all day long, being tense all day long. What is that going to do to your body? What is that going to do to your muscles? It's going to make your muscles sore. So patients with Parkinson's disease typically complain of sore muscles, of aches, aching shoulders, aching extremities. Again, this is due to the sustained muscle contractions. Also, along with this rigidity, patients typically suffer from jerky movements. Number 3, something known as bradykinesia or slow movements. And number 1, tremor, number 2, rigidity, and number 3, bradykinesia. These 3 are typically known as the triad of Parkinson's disease. Again, the tremors, hand tremors, the pill rolling, the rigidity, the jerky movements, the bradykinesia or slow movements. Now the jerky movements will make it more likely for these patients to suffer from falls. Let's move on with our clinical manifestations. Number 4, stooped posture. Number 5, blank facial expression. Number 6, slow or slurred speech. Again, this is due to the bradykinesia, due to the rigidity, not being able to move those muscles for speech properly. Number 7, a shuffling gait. Again, this has to do with the rigidity, the sustained muscle contraction, as well as the slow movements or the bradykinesia. Number 8, insomnia. Again, we just talked about it. These patients have very jerky movements. These jerky movements make it more likely for these patients to suffer from frequent falls. I understand that's not a clinical manifestation, but just putting it in there in this section. Number 10, due to the inability to move frequently, not being able to walk. Remember, these patients most likely are going to be in a sitting position or laying down position. They're not able to move as frequently or as often as they would like. So again, blood will begin to pull down in the lower extremities, resulting in edema in the ankles. Also, you have to worry about other things. I didn't write this down, but you're not moving a lot. If you're not moving a lot, chances are your GI tract is also going to become hypoactive, leading to constipation. So that is also a clinical manifestation or a complication of Parkinson's disease. Before the Nclex exam, make sure you know tremors or the pill rolling effect, rigidity, the jerky movements, the bradykinesia leading to slow movement, and stooped posture. Those are very specific to Parkinson's disease. Now let's focus on some medications or drug therapy that you may be given to your patient. Number 1, Sinemet, which is a carbidopa and levodopa combination. This is typically the most common medication that you will see for Parkinson's disease. Now, one thing to know about Sinemet is that it may take several weeks to months for it to actually have an effect. So if the patient or if the family's saying, you know what, we've been taking this medication he or she's been taking this medication for about 2 or 3 weeks, we don't see any results, make sure you inform them that sometimes it takes several weeks to several months for you to actually see an effect of the medication. So make sure you know that for the Nclex exam. Another medication similar to this is Parcopa. Now, a couple of things that you must know about levodopa for the Nclex exam is that levodopa may actually cause dyskinesia or involuntary muscle movements. If this happens, you need to report this to the physician immediately. Okay, again, if the patient is suffering from any involuntary muscle movements, you must educate the patient, you must educate the family to report that to the physician immediately. Now, the use of this medication, the levodopa, may actually lead to times or periods where the medication doesn't work. And then there may be periods where all of a sudden it does work again. These are known as on and off periods. It's just a complication of the medication, really. Again, make sure you know that for the Nclex exam, that there may be periods where the medication works and when it doesn't work. Now, as far as a clinical setting goes, if you have a patient that has Parkinson's disease, you want to make sure that you maintain their normal medication regimen. Meaning, if they're used to taking their medication at a very specific time, you want to keep that time frame. I know a lot of times when patients come into the floor, come into the hospital, we put them on a schedule that best fits our routines. We may give all medications at 9 a.m., 7 a.m., whatever the case may be. The medications for Parkinson's disease need to be given at the same time. They need to be maintained with their normal routine. Okay, so make sure you know that for the clinical setting. Number two, I'm going to mention a ton of these because I don't know which one you might get on the Nclex exam, so I'm going to hit you with several different medications. If you see them, hopefully you know what they're for. Okay, so the next one that I want to talk about is bromocriptine, or Parallel. Now, this medication, you must know that it may cause orthostatic hypotension. So again, if the patient is taking this medication for the first time, you want to make sure that you tell them to get up slowly. You don't want them to get up quickly. They become hypotensive, they fall, and they have some type of fracture or some type of injury. So again, make sure that you inform the patient that, again, this can cause severe orthostatic hypotension. Number three, Requip or Requip XL. Number four, apomorphine. Now, I talked about how there may be some instances where the levodopa stops working. Apomorphine may be given during those times, during those off periods. Now, if you're going to give apomorphine, one thing that you must remember, you must know, is that it is given subcutaneously and that it causes severe nausea, severe vomiting. Therefore, an antiemetic must be given, and typically the antiemetic that is preferred is something like Tygan. Now, you will not give Zofran with apomorphine because Zofran actually causes severe hypotension. So do not give Zofran, okay? You may also give something like Aricept, or number 6, Benadryl. Now, these are just a few medications. By no means are they all, so please go back to your pharmacology. What are some interventions that you must know for the Nclex exam regarding Parkinson's disease? Number 1, you want to prevent falls. So you want to remove any excess furniture, anything that's going to get in the way, anything that's going to cause that patient to trip and fall. So remove rugs, any clutter from the floor, get rid of it. Again, you want to prevent falls. These patients have jerky movements. They have an impaired gait. So again, number 1 thing is we want to prevent falls. Number 2, we talked about how they're not as active as they should be, which will lead to edema in the lower extremities. So what you can do for these patients is you can elevate those legs, decrease that edema, prevent that edema. Number 4, use of Velcro shoes. Again, We're dealing with patients that have jerky movements. Tying shoes may be very, very difficult. Okay, so make it easy for your patients. Take care of them. Give them some Velcro shoes. Give them some slip-ons. Number 4, again, you want to make it easier for your patients, so you want to provide them clothing that has zippers on them, definitely nothing with buttons. And number 5, you want to make it easy for these patients to go to the bathroom, so you may have to elevate the toilet seat.